Hello, Joan.
Hi.
Hey, Joan.
We're doing the Pledge of Allegiance. I pledge allegiance to the
flag
of the United
States
of America and to the
republic
for
which it stands,
one nation, under God, indivisible, with liberty and justice
for all. Hey, Joan.
If anyone who has read the meeting minutes from the March meeting would like to move to approve, I would appreciate that greatly.
Just a typo, new business. Jane gave an update on the activities of the Citizen Corps, CORP, as CORE. That's it.
Thank you. Typo. Thanks.
Do we have a second for the motion?
Second.
Can we approve by acclamation?
Yep.
All right. Yep. So the meetings are approved as corrected.
Mm-hmm.
And with that, let's go to Marie for the health officer's report.
Sure. Real quickly, Kathy, do you have to adjust those or edit the minutes, or are they good to go?
I fixed the typo for the Board of Commissioner Board of Health, but I didn't, this one was just pointed out. So I'll fix it real quick and send it tonight.
All right, perfect. Thank you.
Thanks.
I'm going to keep my report pretty quick and brief. I know that you guys want to have just a few different discussions tonight. So just real quickly, I just want to mention on the health end, I think that you all missed it. Katie, our health inspector, left Radnor Township. She finished nursing school. She's starting a job at Einstein in a couple weeks. So we're like super excited for her, even though I miss her terribly. So I just wanted to let you know that, she has moved on and is spreading her wings.
Nice.
And then
a plan to hire somebody to fill the job?
That's a great question.
I wish Marie would know.
It would be nice. So I have no update. If I get one, you'll be the first to know.
So okay. It is a permanent position that theoretically, unless a change occurs, we should hire to refill. Is that correct? Being the Board of Commissioners or the township manager, whoever is responsible for the hiring. Is that correct?
Yes, even positions that are full-time positions, when they leave, it would come before the board. The township manager would bring it to us in executive session, I believe, first to discuss. And then because the amount of anyone's salary, crosses the minimum threshold for decision-making, it would come to the board. So I imagine they are talking about that internally now. And then I didn't realize that that we'd lost her. So I'm sure I'll be hearing about it in exec.
Right. And there's no action required by the Board of Health, correct?
I don't think so. I could certainly say that the Board of Health is very interested in seeing this position filled. I will go to the commissioners with that for sure.
Well said.
Excellent.
And I'm sorry, I have a lot of background noise, so I'm going to be coming in and out. At one point, I'm going to probably forget to unmute. I'm just going to put that out there.
Okay.
So Marie, you want to proceed with your report?
Yeah, so I feel like maybe I should just give a little bit of an update on OEM and kind of what we do and what we've been doing. So for newer folks, I guess, Alex, since you've come aboard, the OEM team was put together way early back in the beginning of the pandemic. The team was brought together to review everything COVID related to the township. And what that means is, what we do is our team is constantly reviewing all state and federal guidance, guidelines, and mitigation. It is a daily task that we do. We have more than one person looking at that information each and every day. The businesses are supposed to act independently We do not make decisions for businesses. We don't make decisions for events or gatherings that happen outside our township building. What we do is we will review any COVID safety plan that they've put together if they decide to have an event or gathering, or if they have questions about how to operate their business during the pandemic. You know, if they approach us, we will meet as a team and we will review their safety plan and offer suggestions or give them considerations based on state and federal guidance. We do make decisions on township activities, gatherings, or events that are hosted by the township. For example, virtual meetings, our township building and how it operates during the pandemic. We do meet as a team and make decisions together about that based on guidance on the most recent and updated guidance. We do follow up on all COVID complaints within the entire township. If a complaint comes to any one of us here in the building, it gets sent to the OEM office. We review it, we investigate it, and then we you know, make a decision as where we go from there. We also do you know, we since we don't have a health department, the contact tracing and recommendations for quarantine and isolation were a little backed up. So we took that task on and we did it, you know, for our entire Radnor Township staff. So we followed up on all that. We made recommendations for our staff based on for quarantine and isolation.
Hang on, Marie. You're only doing contact tracing for the staff, township staff, correct?
Correct.
Thank you.
We were able to make, because we got a hold of that information quickly and we worked really well as a team, we were able to really minimize the exposures here at the township instead of our folks having to wait to hear from the county, which, as we all know, in the very beginning, they were backlogged, you know, thousands of phone calls. So
okay.
That's also one of the things we did. And then I guess finally, I did send out our most updated staff protocols that went into effect on March 29th. And the biggest change there was that we did open to the public. So that means all of our service windows open back up. And with that said, we, walked around the building and we instituted our mitigation. We put up signs. We have the face covering mandate available for folks. We enforce, face covering still. So all the mitigation is still in effect, but we did open to the public. So that was the biggest one. That's it. Thank you.
Thank you. Any comment?
Marie, yeah, Marie, just a question. What types of COVID complaints have you been most frequently hearing?
So honestly, we didn't get too many. We had a little bit in the beginning when the pandemic was like, probably during the shutdown order. We had some folks that, did not want to close to the public. We still were having some, I guess some in-person operation. Sometimes we get some complaints on larger businesses, the staff not wearing face coverings.
Okay.
So just that kind of stuff. And really it's minimal.
Okay.
I just wanted to clarify, you're saying businesses, but you're also, I assume that's also including like nonprofits in the township and like other organizations that might be doing events and stuff.
So they're not required to send us their COVID safety plan. They're not required to let us know what they're doing. Those businesses or private entities, yes, they need to make, they're supposed to make their decisions independently based on the current guidance, whether it's state or federal guidance, whichever one's more restrictive. If they bring their COVID safety plan to us, we will review it and offer recommendations or considerations, but they are not required to do that. But yes, it includes all businesses in Radnor Township.
Anybody else? So,
sorry, I had one other question. Have township staff been offered the vaccine at this point, or are they sort of, is it up to them to sort of get it now that it's available to a wider range of the public?
So we were very fortunate to work with Penn to help get some of our staff vaccinated. Initially, we just kept them informed with, the county offerings, and we gave them the link. We provided them the links. We provided them the sites that gave the vaccine, and then we were able to have this assistance from Penn. And we were able to get a good amount of our staff vaccinated. We are not tracking the vaccinations, but we were able to get a nice list over to them to help facilitate them getting a vaccine. They actually, since the opening of, since the allowance of everybody to get it, we've reached back out to Penn, and they were able to take, that last little list of folks who weren't on that phase 1A or 1B. So we just sent another list over to them, and they're working, they're just working with us, allowing our staff to kind of get scheduled through them. So yes.
And this is police officers, that whole department?
So our police officers most of them were vaccinated early on.
Early, okay, thank you.
Yes, and they were actually vaccinated at, a hospital, another hospital, not Penn.
Okay.
Marie, for those who are opting not to get vaccinated, do they have to alert a supervisor or anybody in the township if a township staff member chooses not to? I mean, it's not mandatory, right?
Correct. It is not mandatory.
Is there are they signing a declination form or otherwise attesting that they ever, they choose not to?
Yeah, so we're not doing actually any of that. We had met and we had discussed that on several different occasions. And, at this point in time, we're not tracking who got the vaccine, and we are not requiring them to attest or sign a form saying that they're not going to get it.
Okay.
Thanks.
So since we're on the health officer's report part of the agenda, but we're talking predominantly about COVID, I'm going to take the liberty of modifying the agenda a little bit, and maybe we can finish out on our COVID discussions. Does anybody else have any COVID updates that they want to offer up? I can tell you.
I just have a question. How do you get off the list after I've been vaccinated fully, and I keep getting emails from everybody in Delaware County trying to get me to come get shot.
Yeah,
if you delete enough of the invitations, they'll end up in your spam.
Yeah, they're trying to get hold of people.
Some of them have unsubscribes. Some of them, if you actually signed up to be on a list, most of them have a mechanism to get taken off the list. But I don't think there's any way to avoid all of the solicitations from the various health systems and governmental facilities that are now opening up more. I just don't think there's any universal way to do it.
Okay, I'll give that another shot.
Yeah, Delaware County said that you could email them to take yourself off the list as they were trying to figure out who was still waiting in line. But I don't think that they have been that effective of cleaning it, unfortunately.
They're actually the worst offender.
But I'd rather, that's actually kind of good news.
That's what Montgomery County did. They provided an email that if you had received the vaccine elsewhere to email them. I don't know if that has been effective for folks in Montgomery County or in Delaware County, but I guess probably just sending that email might at least.
Yeah, initially I registered on the Chester County website since they were taking care of Delaware County, and I have a suspicion that's why I can't get off the Delaware County list. But well, anyway,
I'm sure they just don't have the resources to manage.
So I want to take a brief minute and give you my sense of where we stand with the pandemic, actually more specifically with the epidemic because locally epidemic, and that is nationally, there has been a significant fear of a new wave. The high level of cases that we saw in the midwinter tapered rapidly and then have plateaued. They remain plateaued at a relatively high level. This is on a national basis. And I go over this, but national data are not terribly relevant to the decisions you make on a day-by-day basis, because what you really want to know is what is the prevalence of the virus in the environments in which you are going to put yourself in a position of being potentially exposed. But for want of better data, it appears that nationally cases are at a constant plateau in the 70,000 a day range, but testing is significantly off. So I don't know what that means. And it's hard to get data on national percent positivity levels. Deaths have continued to drop off, and they have also plateaued at a significantly lower rate, somewhere in the 900 a day on a national level. And again, that's not actually granular enough, but the hospitalizations do appear to be creeping up, and the best integration of that data that I've heard suggests that what we have is that there's a combination of factors, including some natural immunity and some vaccinated immunity, and the vaccination is predominantly an older population, so that there has been a leftward shift of the age curve, and the population, and that leftward shift of the age curve has also probably been accentuated by the fact that the predominant emerging strain is no longer what we could call the Milan strain, and is now the what has been called the UK strain, the B1.1.17 strain, which does appear to have a greater proclivity for infecting people in the middle of life. And so hospitalizations may turn out to be the best leading indicator, but it does not appear that any national new wave has actually emerged, nor does it appear that the epidemic is disappearing. And if you look at everything taken together, the reproduction number has certainly not fallen below 1, and that's generally the signal that a pandemic or epidemic might be over. When I looked at the last looked at the numbers for Chester County and for Radnor Township, fortunately, we have seen a small uptick, but it does not seem to be a continuing rise for Chester County in general. And the numbers in Radnor Township have actually been pretty good. And then and that's all I have. I haven't looked over the weekend because I actually find Saturday, Sunday, Monday numbers to be terribly misleading. And it's not till the middle or the end of the week that the numbers really tell you what's happened in the preceding 7 days. So that's my take on things. Things continue to percolate. They're not terribly hot here, but the pandemic is not over, and we need to continue to assess risk and be smart in wearing masks, avoiding contact, and distancing, and the other things that people are doing to keep themselves safe. And so I leave that on the table with an invitation for anybody else to weigh in with comments.
I just read a statistic that about 25% of the American population is now vaccinated.
With both doses, correct?
I'm sorry?
It's hot with both doses, correct? Yeah. I think it's higher if you had the first one.
Yeah.
Yes.
I will say, I mean, I can only speak to one hospital that isn't even in Delaware County, but we're definitely seeing more hospitalized patients in their 30s and 40s with severe cases of COVID. So, you know, I've been encouraging, you know, all of my contemporaries and younger than me, like, you know, you can still get a severe case of COVID here, you know, I know in the beginning we were focusing on vaccinating older individuals. Now we have to focus on convincing the 20s, 30s, 40-year-olds to be vaccinated.
And the most,
or if they don't want to be vaccinated, then continue social distancing.
The most convincing evidence that they should is that when you look at the data on the vaccinated population, they're not going to the hospital and they're not dying. And those were the people that were going to the hospital and were dying. So there's some proof of the wisdom of the approach to vaccination that was taken.
It'll be interesting to see now that it's opened up. You can get appointments easier. The ages have been lifted to see how the vaccination rates continue. See what happens to the rates now. That we have 18 and over, I think, or 16 and over is the new age right now. See if the youngers do step up.
Now there's a new problem with the supply that wasn't there before.
Well, yeah, the whole J&J thing. Yes, yes, true that.
So that has led to cancellation of some inoculation days in some places, but there is still a pretty substantial improvement in availability to desire for inoculation ratio. There are, in places like New York City, people are walking in. Jane maybe can do a better job than I of addressing CCMC, but I've been volunteering with CCMC, and people are coming through. The days the schedules are filled, and they're soliciting volunteers, and so I think we will probably hit a good equilibrium between supply and demand in this country, even without J&J. Or in this part of the world, even without J&J. And I think that we will probably hit a bigger problem with vaccine hesitancy limiting complete effectiveness of achieving the broadest vaccination possible than we will hit another crunch on vaccine availability, but that's speculation.
Well, my understanding is that and I can't remember the country, I'm trying to find it here, accepted the J&J vaccine from Great Britain. So maybe there'll be other countries that are willing to take the J&J vaccine, so it will not get wasted where, you know, in our country, it's been put on hold. So yeah, that's very hopeful.
It is. Truthfully, we don't know, and what we don't know about the 6 cases is a lot more than what we do know. I actually applaud the process. I think that although it has made a lot of people freaky deaky about a risk that is a whole lot smaller than turning on your car in the morning and getting out on the highway, to be frank, you have a greater risk of dying in a car wreck than you do of dying of a blood clot from a J&J vaccine. Nonetheless, having been involved in drug development for the last 20 years of my life, the same people who are howling about the decision to put a pause on to do a deeper investigation would be the same ones that would take you to court tomorrow should somebody die after the suggestion was raised to put a pause and before we had any real rational understanding of what went on. So I think the argument that what they have done is to convince the American public that the process hasn't been shortcutted or corners haven't been taken was a wise decision, but it has absolutely resulted in a lot of emotional distress on the part of a lot of people.
Well, the other consideration is to offer the vaccine to menopausal women that are not of childbearing age, that are not on birth control, and also to men. So that is another way to
sure put a black box warning around the population that appears to have been, but I also have to say that sinus thrombosis is rare, but it is really hard to put a number on the background incidence, and women of childbearing age are known to have a greater incidence of thrombotic disorders. The problem with this particular thrombotic disorder is it is a thrombocytopenic clotting disorder, and those are even more unusual than just clots in people in whom you would otherwise not expect.
It's cerebral too, isn't it, David? It's
cerebral
sinus. Cerebral.
Exactly. Yeah, cerebral venous sinus. So I actually look forward to hearing the results of the investigation during the pause. Tony Fauci said probably by Friday that will come out, and I think that then the communication cascade, assuming that see, a lot of the investigation is to really get out there and say, is it really only 6 cases? Is it really only confined to women 18 to 40 years old? Right. And when you have that information, then you can take a more informed approach to communicating risk to the public, to putting a black box, a warning around the risky populations, and to selling to the remainder of the population the fact that the risk is vanishingly small.
Do you know, David, if it's been those 6 cases, were they women of childbearing age, but were they people who were on the birth control pill?
Great
and
question.
Is that thought to be the reason?
So the 2 things, I have no more information except that one of the 6 women, so what my data were 1 woman died and 1 woman was hospitalized. The other 4 were not either dead nor hospitalized.
Right.
And that the woman who was hospitalized was a Pennsylvania woman from Montgomery County in the hospital in New Jersey. I have also had no luck in trying to track down the data on the AstraZeneca. My belief is that you will probably find that the clotting abnormalities there were probably similar, and that the whole thing is going to be similar, but I just can't get anything approaching factual or quantitative on that. So I think we remain in a bit of a fog on that whole thing. But I feel fortunate that I got the Moderna vaccine.
Well, I mean, I was in for a J&J vaccine at my appointment, and of course it got canceled. And they set me right up with a Moderna the same day in the same slot, just different location. I couldn't go to Media, I had to go to Ashton. So they took care of that list pretty quickly.
And when everybody was bringing hands about the scarcity that we had when this first rolled out, that couldn't have happened. And that just suggests to me that in fact, we're starting to hit an equilibrium between supply and demand for this.
Yeah. I was like lucky they just set up the same date and same time. So it worked out pretty well.
Did you go buy a lottery ticket that day?
Yeah, really. I'm only one. I'm waiting for my second one, but it all worked out.
Okay, so
do you have any? Sorry, David, just to another issue. Do you have any numbers on folks who are turning up positive after being fully vaccinated? Are there any numbers on that?
After full vaccination, it's under 5% in the largest populations that you can look at, which is let's see, the Israeli study.
And where are you getting that from? Is that nationwide? Is that global?
So the U.S. data is restricted to some subpopulations, and I don't know the number of infected individuals. It's in the 5% range in small cohorts in the U.S., and it's in 5%. It's right at 5% in the Israeli population, the broad population of 500,000 people.
Just the Israeli data. That's it.
That's the
best. There's data, I think, in healthcare providers. David, is that what you're referring to?
Yes. Thank you.
So it was in healthcare providers, I believe, in Texas, and it was not just symptomatic COVID. They actually COVID tested them.
Exactly.
And I think the 5%. I just remember it was substantially less, obviously, than the people who hadn't been vaccinated. And it was looking for even asymptomatic infections, and I believe that was about 5%. I did see a statistic recently about the number of hospitalized individuals who had been vaccinated. It was less than like 0.00% in Pennsylvania. Of course, that doesn't take into account
0.025%. But actually, the data that you said in the healthcare workers, it was in Texas. And in fact, the 5% was total infection for them, including, and in fact, that included people once they got their first shot.
Right.
And
okay.
there were, I don't even think there was one case in individuals that had occurred 2 weeks after the second shot. So there's a really high level of protection in the fully vaccinated.
But is it fair to say there's still no broad-based national data yet?
Oh boy, don't hold your breath.
Okay, just checking. Okay.
And the other thing to remember is that when risk is not 0, it's either 0 or 100%. So there's no such thing as a 5% risk. If you continue to wear masks, social distance, and protect yourself from high-risk exposures, then you decrease that 5% every time you don't go into a circumstance where you have a high risk. The 5% are probably a result of people being in higher risk circumstances, either inherent to themselves or the circumstances in which they found themselves wittingly or unwittingly.
Yeah, but at some point, let's just say we all want to take our masks off at some point.
So,
At some point.
Right.
So
Exactly
I think
right.
Israeli just did that. So maybe there'll be further study. I think they just lifted the mask mandate.
I'm sorry to interrupt. There has been no uptick. So Israel has opened up and there has been no uptick in cases, hospitalizations, or deaths there, despite the fact that they are a place where the B1.1.17 is the predominant strain, which is the other piece of good news. So the thing we don't know is the level of, a couple things we still don't know is how long will this immunity last, and what is the level of protection against the mutant strains, which is the best argument for not going hog wild and just opening up because you feel like opening up. And I think that the evidence might be that if the 1.1.17 becomes the dominant strain, that is almost good news, because if it outcompetes the South African, Californian, and Brazilian strain and New York strains, which may have less susceptibility to vaccination, to the antibodies of vaccination, if the 1.1.17 outcompetes, then we have less of a chance of mutant breakthrough in vaccinated populations. And then the whole thing, all of these risks are calculated based on the risk of the individuals that you are in contact with having and spreading virus. So the less virus out there, the better the vaccine is.
Sure. Yeah. So we opened up for dining at 75%, and the bars are open now. In the last couple of weeks, has there been any data to see if there's any impact on the occupancy rate of indoor dining or the bars opening up?
Isn't there usually a lag time that between them opening and what we will see in terms of the statistics?
Yeah, I mean, maybe Marie, do you get data coming in, Marie, from the township at least? You're on mute, Marie. There you go.
Sorry about that. You mean data as far as like what Jane was saying, the latest stats is since the restaurants have increased capacity?
Mm-hmm. I mean, that was a concern, but just we don't, they opened up and now we sit at a bar.
Yeah. So what, like earlier, like I said, our team is constantly reviewing all the updates from the CDC and the Pennsylvania Department of Health, and then I also get information from the Pennsylvania Department of Agriculture. They're a little bit later than Department of Health and CDC, but we typically pick that information up really early because we are constantly looking at daily we are looking up information. So I've not anything related to that. I do remember getting out with that, in the past, as far as, the cases were, pretty high in the restaurants, but I've not seen anything so far.
Okay, good to know.
Marie, isn't one of the other...
What's that, Al?
I'm sorry.
I was going to say, isn't one of the other laggers that I understand that the self-certification process that the restaurants have to go through, even though in theory it's like this easy thing, that the state was actually, like the website was actually running very slowly. And so a lot of restaurants weren't actually getting their self-certification for a while after they did it, even though it's supposedly this like easy thing.
Yes, it is much, much better. I will tell you that. But in the beginning, I mean, you couldn't even get on the website. They weren't getting any information back. They weren't getting emails back. Their directory was non-existent. So we really just were going on their word of whether or not they self-certified. We've reached a point now where it's updated. We can go to the website. They have right on the state, the Governor Wolf's site, website, and we can see who self-certified. We can look it up super quick. And then I just had a restaurant do it the other day, and they got their instant certification. So yes, we've come a long way, and it was a long time in the beginning.
Okay. Any other comments?
I just wanted to make a comment. What I have been experiencing with younger people and their desire not to get the vaccination, and their argument is that, we're young, a lot of young people don't get a full-blown case, and we just have to social distance, and I started discussing the fact that there's a community responsibility that we have towards each other, and have they ever considered that they might be a carrier and unknowingly infect another person? And a lot of the young people have not thought about that. Does anybody want to comment on that or share their experiences with trying to convince younger people, and I'm talking 20s, 30s, to get vaccinated?
Well, Alex is a young person.
I was going to say, I mean, yeah, I mean, well, one thing I can say about that, I mean, I obviously, growing up with the mother that I grew up with doing vaccine education, I, you know, never had that personal feeling myself. I mean, one thing to certainly keep in mind is I know, I think there's maybe a little bit of a bifurcation between sort of general vaccine hesitancy and hesitancy over the COVID vaccine in particular, where we've seen hesitancy over the COVID vaccine from, you know, particular populations that maybe have common interests over politics or anything like that. In terms of general vaccine hesitancy, though, I wouldn't be surprised if actually that is more of a younger thing. I know certainly working in a retirement community, so a lot of the residents there, yes, they talked about concerns, but then in the end, 95% of them were vaccinated after the first 2 clinics. On the other hand, for, you know, people my age and younger, you know, polio is like a historical thing for a lot of them, especially if they haven't traveled. And it is one of those things where vaccines end up being a little bit of a victim of their own success of we just don't see a lot of these diseases. I mean, even things like rotavirus that are deadly in other countries are not deadly here. I can tell you, I mean, the biggest thing I think really for like on a case-by-case basis is if those people have somebody in their life who is an advocate for vaccines. I mean, that's certainly with a lot of the people I work with, that can be like the difference between them getting the vaccine and not, is if they have someone in their life who's really trusted, who is telling them, yes, you can do it, it's safe. Or on the other hand, if they have someone who's someone they trust as an authority figure who's saying, you know, no, wait, or don't do it. I mean, it's not an easy question. And as far as the community responsibility piece of it, I think you're right. That is an incredibly important piece of it too. I don't have an answer for how to convince people that they should care about that if they don't already. I think, but certainly talking to the people in your own life that you know who might be vaccine hesitant is incredibly important.
Yep.
Yeah, I would totally endorse what you said. I think that if you, all week, I don't think that we have, as the Radnor Township Board of Health, have the capacity to engage in a communications cascade that might be helpful there. But I think public health communications cascade would be really helpful. And I think that the comments that you made, Jane, you could substitute mask wearing or social distancing for getting the vaccine for everything you said. And I think in the youthful population, you would have some of the same things, same attitudes that you were alarmed about with the vaccine. I think in individual conversations, what Alex said, the most effective tool is remind them of their mothers, their fathers, their grandmothers, their grandfathers, their aunts, their uncles, their nieces, and their nephews, and that it's not about them, it's about protecting other people.
Yeah, I would say though, I think we should keep in mind, just because, you know, even if the one-on-one conversation we're sort of framing it as, well, younger people aren't necessarily going to, you know, say, okay, the Radnor Township Health Board said this and that, you know, that we're saying that dynamic doesn't necessarily happen. But there is also still the opportunity of talking to people who they will listen to. Like, the example I think of off the top of my head is, I know in some communities, they've already found that it's been incredibly effective to reach out to church leaders and then when those church leaders get on board, that's been a big deal for communities that have been skeptical. So there are, you know, also those other avenues other than the direct avenue that are possibly open as well.
That's a good thought.
Marie, am I on mute?
No, you're
no, Jen, you're good.
That's a good point. It was a good point. So Dr. Fauci was on last night actually talking about that very thing, that the reason that mask wearing is still being encouraged, whether people are vaccinated or not, is because it can survive in the nasopharynx and still transmit it. So, which confuses me about testing people for positives, doing the nasal testing when they've been vaccinated, because the virus can still be there even though they're not truly infected, they're just carriers. So I am confused about that.
That goes back to some of the testing uncertainty and what test you do. And once you're vaccinated, you can't do a test for antibodies. So you can do either a nasal swab for PCR. And the problem with PCR is that it is highly sensitive, and people can continue to shed fragments of virus after they're actually shedding virus. So we're stuck with a certain level of uncertainty there.
One reason you also might hear more about testing is also just that places are working with what they have, and some places might be doing more testing now than they were before, and they should have been doing it the whole time, but they've gotten their staffing in order now. And so now they're doing the testing they should have been doing before the whole time.
Because people are opening up, because businesses are opening to get more staff on site.
Right.
Yeah. There are some businesses that are having more staff on site.
Right. I mean, well, I can tell you where I work, we're actually getting tested more now than we were even at the height of the pandemic. And part of that's just because we have more nursing staff or you know, more testing staff available now.
Right.
So there is also just the fact that people are working with what they have.
So I'm going to take the liberty in that we're way downstream on time, and COVID is an inexhaustible topic, and we appear to have lost Joan. I'm hoping she froze up and then dropped, so hoping she's dialing back in.
Can I just, sorry, 2 points really quickly. One, because I don't think we addressed this, but just if there are members of the public that are listening, that my understanding is that the vaccine does provide better immunity than actually getting the disease from what we've seen. And I think that's an important point to have out there.
I would have to say that I don't know that it provides better immunity, but it provides higher IgG neutralizing antibody levels, which is not necessarily the same thing.
Okay.
And the other point I wanted to make really quickly is that my understanding is that sometime in summer, we are looking at possibly the first two vaccines, Moderna and Pfizer, coming out of emergency use, which would give businesses more leeway to require the vaccine as a condition of working, which could also be a big turning point.
But that's a really good point, as is the debate that is about to come up on what they've already started to implement in Israel, the so-called green passport or vaccine passport. So we'll probably end up having to talk about that sometime downstream. So looking at the agenda, what I'd like to do is coagulate the old business and new business and have the student intern project update first, and then turn the floor over to Maura. So is that okay with you, Maura? Great. So I'm going to turn it over to Jane for the student intern project update.
The student intern project is at a standstill right now because they have not been able to connect with the administrators and the teachers that they are trying to work with this project that they're doing. So we've been in communication, and we feel at this point that we'll probably have to redirect a little bit so they can complete some sort of aspect of this project by the end of our next June meeting. If if either of you like to add to that, that would be great. Suman, Trisha?
Yeah, we're not really sure what direction to head in. So if any of the members have any advice, it would really be appreciated.
Sure. How about you, Trisha? Any thoughts?
Yeah, so we had the survey ready and we just wanted to distribute it to our students, but we needed approval from the director of learning, and his name is Dr. Bechtold. So we talked to him I messaged him through like our school app, Schoology, but he didn't respond. So we were going to seek him out in person, but I'm not sure if I don't think he's at the school. So I don't think we can do that. So.
Okay. I think, it's now April. We have 2 more months. So I think we need to somehow figure another route out. And I don't think the survey is going to happen because you do need to get approval, and you also need to get approval from the school board. And that takes a lot of time. So we're going to, Dr. Hammock or Dr. Simmons and I are going to work together and help you to come to some sort of way that you can, continue on with the concept of mental health with high school students. But we just need to go into another direction at this point.
Yeah, I think the survey, by the time you get it out, get it back,
it's going to take a long time.
Yeah, I would.
So my suggestion is that we, as Jane said, we take it offline to the small group involved in the project and figure out how we can. My suggestion to the 2 interns is to do as much deep dive research as you can on the topics that you've covered, button that up, tighten up your survey with whatever help that you can generate. And then we'll put together a report to finish the year on what you have been able to produce, understanding that it's been a very difficult year.
Okay.
Sounds good.
Okay.
Yep.
So with that, the old business that we listed was that I listed was the Delaware County Board of Health project update, which is one thing that will almost certainly have an action item here, and I don't want to lose that before we're done. And the other I had was a review of past Board of Health projects, which I can go over in more detail when we're not as time crunched, but both of those were part of a conversation that I had with Commissioner Mulroney that has been one of my main both frisson and pushes, and that is I really would like to leave as my legacy as chairman a Board of Health that is more tethered to the needs of the township, almost certainly through the Board of Commissioners, as well as perhaps through the Board of the Office of Emergency Management, and perhaps through a better relationship with the school board, which is distinct and independent from the Board of Commissioners. And as well, that was part of a conversation that I had with Marie and Commissioner Mulroney. So she wanted to bring something to us from the commission. So I'd like to turn the floor over to her, and then we'll kind of tidy that up before we're done.
Sure. Thank you very much, Dr. Simmons. Yeah, we had a really good conversation today. First of all, I don't make it to all of these meetings. I'm promising to step up my game a bit. I usually have a conflict, but trying to work around that and be here more often. But at the last Board of Commissioners meeting, Commissioner Lisa Borowski brought up the issue of accessibility, ADA compliance in the township as a general concept for the board to sort of, she was just getting what we call a sense of the board. Is there the will of the board to ask the staff to look into it? Are there boards or committees that might be able to take up this mantle? But we know that any of the new planning and land development projects that go in have requirements to meet, but there are a lot of old properties that are owned by the township that maybe could use some updating. I, of course, recalled that the last student project, and I was here for this amazing presentation of the intern who presented on ADA compliance and handicap accessibility throughout the township. So I just wanted to bring it to this group, not particularly asking you to do anything, but help us think through how we might be better at making our township accessible to all of our residents. There's also a proposal that we might look to the planning board or the zoning commission and look for a particular seat on that board to have somebody with that type of expertise always be able to advise in. So this isn't the only suggestion, but it was mine based on what I had seen at a prior meeting. So I just, whether or not it's in the purview of this board, I just wanted to get a feeling then from you if there's a way to collaborate between the Board of Health and the Board of Commissioners on this particular issue. So if you, have any thoughts on it, I welcome them. We did also, into, Dr. Simmons and Marie and I sort of delved into some other issues about how we can sort of tighten up how we relate to one another, how we elevate this board to the community as a great resource, wanting people to tune into these meetings, get the good information about COVID-19 and that sort of thing. But to the issue of accessibility, is that a feeling from this board that it's something that you would be able to take on? Is it within the purview of what you do? Do you feel the community would be better served with us looking at it from a zoning angle? Just wanted to put it to you.
I personally think it would be multidisciplinary. We can look at, I'm just, going around in my head exactly what we could do. And the first thing I'm thinking is doing a similar kind of thing as our student intern had done and go out into the community and, make observations. But other than that, I'm drawing a blank on how we could be helpful with this.
I have a suggestion. I think that in order to, I think what you're saying is to get people to participate more in proceedings with the township. Is that correct? The meetings and so on and so forth?
Well, I sort of jumbled some issues together.
Disability?
I was sort of collapsing perhaps some issues based on a conversation we had earlier. So the one issue on the table is this was brought up at the Board of Commissioners meeting about accessibility issues around the township. And if we were to task a group with it, is, what's the right group for that? I like the multidisciplinary approach, but because I do think it has a lot to do with our zoning to make sure that we're compliant and all of that stuff. But so is there room for it here at the Board of Health? Is it not the right place for it? That can be the answer. It really can. So I just
what's the last thing when you say accessibility? I'm confused.
So perhaps
wheelchair ramps and
parking spaces.
Yeah, sort of the physical accessibility issues on township owned property. That's older because so it's properties that maybe need upgrading to become compliant, or even when you look at some that are compliant, on paper, is that really the best way to, allow somebody with mobility issues to access that space, that sort of thing. So it seems to me there has to be some sort of survey and audit, that is probably our codes team does that in the regular course of business. But I think a little bit more digging into, issues of accessibility around the township. So like I said, it was brought forth by another commissioner. I just said I would bring it up here to get of your feedback and response.
So I don't hear anybody on the committee jumping in and saying this is something that I love and have particular expertise. And that's really why I wanted you to bring it up was to see if there was. I don't know that as a committee, issues of code and access are a particular area of expertise. And I can tell you that Leah, who was the intern who did that report, did all of that legwork. I wouldn't have a clue how to start out.
I wouldn't have a clue either.
Right, and like I said, that could be the answer. It was simply that I was triggered. You know, my memory was triggered by this request that there had been a presentation here and a project that I knew was a student project, but I just didn't know, since I haven't been at many of these meetings over the year. I didn't know if that was issues that you had delved into as a broader board. So it sounds to me like there's not a sort of the immediate, like it doesn't ring a bell right now that it makes immediate sense for this group to get a deep dive into it. But
no,
maybe
it sounds more of it like
like
a building a code and zone type of topic, not a health issue per se.
Okay.
So it sounds like to me.
Sure. Well, that's what I needed to hear. Thank you.
Yeah, my pleasure.
I was also just going to say the solicitor might, because the ADA is a law, the solicitor actually might be able to provide some guidance on which, you know, boards are able to best address it for the township.
Well, to that point, like I said, you know, the codes are up to date. You know, they are compliant if you're building new, but there is a lot of property that hasn't been looked at. You know, there hasn't been a reason to survey it. So, you know, just looking for who might have the bandwidth. There's been some community outreach to another commissioner about some spaces not being accessible. But this is great. This is what we needed. We'll go back to the Board of Commissioners and say, let's sort of look at zoning and codes and find another way to approach it.
Thank you, Commissioner Mulroney. And to kind of close that loop up, the commitments I made earlier were to for me to work with Commissioner Mulroney on working with the Board of Commissioners to get maybe a tightening up of our understanding of our role and a tightening up of the communications between Board of Commissioners and Board of Health, so we can be more directly tethered to the needs of the township as represented by the Board of Commissioners. That was one. The commitment I made was that we would continue with our work, which is completely relevant to that, and I think directly related to our work as Board of Health, to work with the nascent Delaware County Board of Health and Health Commissioner, and maybe do that with the imprimatur that we would bring things back to the Board of Commissioners, as we always should, and that we are representing the Board of Commissioners and the Board of Township in our work with the Board of the, as I say, nascent Delaware County offices. That we would, working with Marie, work to more highly organize our communications cascades with the Office of Emergency Management, which is the full-time arm of, not the part-time volunteer arm of the township with regard to what is going on with COVID. But I think that we can be better linked to them and of more service to the Office of Emergency Management. And then let me just look at my notes. The board, county board, OEM, and also that we would work to try and figure out a way, since so many of the health issues in the township do end up relating to the youth of the township, and therefore work through the school board, try and figure out a way that we can be better tethered to the school board. So those were the action items that came out of our earlier discussion. I lay that on the table for two reasons. One is to ask Marie if she can help to reach out to the folks that we need to reach out to assure that at our May meeting we realign with the county folks, and then to put all this on the table for our board here. I did do a complete review of all of the minutes of all of the meetings that we have had and what are the topics that we have gone over in the past. And I think that's actually a long discussion. And I think I'd like to defer that discussion to our next board meeting, because I think there are some places where we could pick things up, like being responsible for assuring that the township is represented in things like community mosquito control, and like figuring out where we are in the Radnor 100 and its relationship to things like gas blowers, leaf blowers, which is something that we've taken up in the past and just kind of think is hanging out there. But I'd like to defer that more complete and detailed list to the next meeting, if I may, and suggest that the other thing we have at the next meeting on our agenda is a loop back with the county folks.
So David, you're asking for a May update from the county folks?
Yes.
Is that what okay, got it. Thank you.
So Dr. Simmons, you want me to see if Dr. Taylor and Grace Garnflow can come back to the meeting, or you want me to just get you just want a statement suffice?
I'd like to see if we can't get them back for a portion of our meeting. We don't need a formal presentation, maybe an update on the formal presentation, and a discussion with them as to where things are moving with regard to what the county sees as the role or lack thereof of township boards of health.
Okay. I make a suggestion as maybe something that we could put on the agenda for the next meeting. I was looking at the mission statement, and sort of in light of some of my concerns about environmental issues in the township, and interesting you mentioned about the leaf blowers and the mosquito control. I do have some concerns about a lot of what goes on environmentally in our township, and also as far as the health and safety of the wildlife in our township. And I think that our mission statement has a pretty big void in it, in that it just mentions matters of public health, and it concerns only human health, but yet we have so many other lives, animal lives in our township that we ignore and really harm. And I think as far as the environment, I think that's got to go in there too. And that kind of goes full circle, big time, into public health. And I would like to look at that statement and maybe think about goals going forward in terms of generally making this a healthier community from not only a direct human standpoint, but also the environment that we live in and that we share with other creatures as well. So I don't know.
Think that is a process. It's something that you're suggesting that we take on in the long term. So what I heard was that you have volunteered to kick that process off as an agenda item for our next meeting, and we'll be sure and include you on the agenda.
Run it back to me.
No good deed goes unpunished.
Don't worry about that.
And with that, I would
say that slick, David.
Say again.
That was really slick.
Thank you. So with that, I would like to solicit a motion to adjourn, unless there's either public participation, which I don't think we have, or anything else that we need to accomplish before we close.
Can I just ask, because you talked about reconnecting with the county, but the other group you talked about was reconnecting with the school board. And I know we used to have a liaison from the school board, but we don't right now, is my understanding.
We did, yeah.
So I think that, again, that is, I don't think we're going to get that taken care of today, but that is absolutely one of the items. What should our relationship with the school board be if we're going to be an effective and efficient board of health? And so again, if you have ideas, please share them in the next meeting, because I think we take that up as, I don't know whether we'll take it up as old business or new business, but we'll take that up in more detail at our next meeting.
And David, Marie had an ask about the animal control policy, Marie?
I did. I did. I don't want to double up Dr. Capuzzi's plate here, but
so
I had made a suggestion, Dr. Capuzzi, at last month's meeting, or actually had just asked if maybe you or anybody would be interested in taking a look at our animal ordinance. It's very outdated, and we have, we still handle dog bites to people from years ago, and the state has updated, you know, what they do, and we're still doing, you know, something from many, many years ago. So, you know, we continue to do that because that's what our ordinance says. So I was just curious if you wanted to take a peek at it and, you know, tell me your thoughts on it, and, you know, if it's something you're interested in.
I'd like to. Yeah.
Okay. Perfect.
Where can I find it?
I can either email it to you, but if you go to our radnor.com and go down the bottom to municipal code,
right,
and it's like a little circle. When you click on that, up in the search button, just type in animals and it'll take you right to the ordinance.
Okay. Yeah, I'll take a look at it.
Okay, thank you.
You're welcome.
Mm-hmm.
Do I hear a motion to adjourn?
I motion to adjourn.
Second. Second.
Ayes.
Second.
Ayes.
Ayes.
6:40.
All righty.
All right.
Thank you, everybody.
Bye, guys.
We'll see you.
Good night.
See you next time. Same bat time, same bat channel.